This program was produced by and first broadcast on Radio Kidnappers, a volunteer-based community access station. For more information, go to www.radiokidnappers.org.nz. Thanks to New Zealand On Air for making this program available through funding the Access Internet Radio project.
You're listening to Radio Kidnappers, the voice of Hawke's Bay. This is a program called Acupuncture On Air, and it's our pleasure as always to have in the hot seat Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm really good, Ken, and you. And we've got another great speaker again today who's been on the show a few times with us already. We have Hamish Reid from Melbourne. How you doing, Hamish?
Yeah, good, thanks. Morning, Heiko. Morning, Ken. Great to be back, and morning to your listeners as well.
Oh, good to have you on board. And what are we going to talk about today, Heiko?
Well, we're going to be talking about, it's quite an interesting topic, I think, it's just general problems to do with the neck and acupuncture. And there's many types of problems, as we know, we can get with the neck. And I know that when your wife has spoken with me, she says that you're a bit of a pain in the neck. But I don't know if we can help that, but there's many other conditions we can help.
I knew you'd get that one in.
No, and one of the interesting ones that I think I'd like to do first, and then depending how much time we have, we'll talk about other neck conditions as well. But it's disc herniation of the neck, because we hear about disc herniation of the lower back, and that's a common thing. But the neck one is also quite a debilitating and a terrible problem for patients. And I'd just like to sort of talk to Hamish a bit about that, but. First, sort of about, is the cause of this more wear and tear of the neck, or is it more commonly from an injury per se, Hamish?
Look, I think one really leads to the other, mate. I mean, and you're right about the disc herniation that the back's a lot more common, but with the neck, I mean, we'll see people like jewellers that look down all the time, mechanics that are looking into engine bays, things like people that are staring at the computer. But like you said, I mean, look, with the wear and tear, one will lead to the other. I mean, I should clarify for your listeners as well, when we talk about disc herniation, it can also mean exactly the same thing as things like bulging disc or slip disc or ruptured disc. It all essentially means the same thing, but it gets a bit confusing when we see all these different sort of translations. And look, just for those unfamiliar with what an actual invertebral disc is, the invertebral disc lies between each of the vertebrae and has the function of firstly creating a bit of suspension for the spine and spinal joints, but really also the position of the disc being between those vertebrae start creating a space so that the nerves can actually exit from the spinal cord and feed the other areas of the body. But yeah, look, I feel there has to be a weakness first, Heiko, which can really come from wear and tear, and what that does is really cause a lack of lubrication of the disc, and then that's going to result in the disc becoming drier and less flexible, and then that'll pave the way for an actual disc injury or herniation to take place when the patient goes to lift something or is involved in an accident or that kind of thing. So, yeah, to me, a disc bulge or herniation, it's sort of more the end result, or rather the last straw in a chain of events, which may well have started a few years ago, I reckon.
I wonder, Hamish, if neck problems are part and parcel of getting old and degeneration of the body. What are you saying, that acupuncture can reverse the aging process and make it all better again?
Yeah.
Well, bring it on.
Yeah, I think it works well, Ken, but not that well.
But just say yes, so he'll book into me at least 3 times a week for the rest of his life.
Yeah, that all good, mate. Yeah, no, for sure. Look, if we could, we could reverse that aging process, we'd be pretty amazing, I think. But even though going by what you were saying there, Ken, I mean, even though the patient may have irreparable wear and tear, because a lot of people do in the discs of the neck, there is still a lot we can do. Now, we unfortunately can't replenish cartilage, which is largely what a disc is, but what we can do is maintain the integrity of that existing cartilage and with acupuncture. And look, essentially we use techniques which strengthen bone marrow. There's a lot of good acupuncture points which will strengthen bone marrow, which is a major part of the cartilage. And look, if we can strengthen that existing cartilage, even though we can't replenish it, we can try and reduce that further wear and tear to the best of our ability. But I feel I should mention here the other mechanism of acupuncture in this case, in terms of maintenance, that really helps is its ability to direct blood flow to the spinal joints and the discs themselves. So if we can direct blood flow there, we'll get an increase in lubrication and ease of movement. So I like to, when I explain this to patients, I like to use the analogy of a car motor. So we say if the motor doesn't have enough oil, the moving parts of the engine will start wearing and cause premature engine damage. So we need oil for lubrication in the motor in the same way we need those sort of healthy and plentiful supply of blood to the neck. One other thing, sorry, just don't forget that the numerous neck muscles also around the spine. I mean, there's 5 layers of neck muscles, and they're going to be really tight because they're trying to protect the affected disc, and again, that's going to give rise to a host of other problems too.
What I find is, what I've observed over the years, which is quite interesting, but more so with lumbar disc herniation, is that often the patients that they've been and they've had an examination, an MRI, for example, and it showed that they have quite a serious, disc problem or a bulge, but they don't have any problems, they don't have any pain, or they don't have any numbness. And then other patients that I've had, they've had the scan and there's like the report will show, there's a tiny little bit of a bulge, but they have severe pain and numbness, and then you have everything like in the middle as well. And what I find often is that, sometimes I think, well, I don't know what I'm going to be able to do, and I start to treat, and then the patient say, yeah, look, it's much better now. It's all these problems, but they haven't gone back and had another scan to see if has it actually gone back or has it changed. What's your sort of opinion about that, Hamish? What do you think is happening there?
Yeah. Look, it's certainly interesting, and it can get a bit confusing. But look, I think what you're saying in terms of, there can be pain or there can be no pain, but it all really depends on where the bulge is, where the disc bulge is. It'll sort of determine if and how much pain is there. So, look, in my view, it's a bit of a luck of the draw type scenario. But look, if I explain this using another analogy, I mean, firstly, if we take a disc, a cross-section of the disc, you'll find 2 main structures, which is the thick fibrous sort of ring of cartilage on the outside and that's called the annulus fibrosus, and there's like a viscous gel inside called the nucleus or nucleus pulposus. But when I explain this to patients, I ask them to picture a jam donut, a nice jam donut with the dough on the outside.
That sounds good.
Yeah, with the dough on the outside being the cartilage, and the jam encased on the inside being the gel. And I know I'm probably making you guys hungry now, being breakfast time, but when a disc gets dry, like what we were mentioning previously, and the patient will lift and overstrain, then a crack tends to develop in the disc, and when that happens, the gel starts seeping out. And then once the gel gets to the edge of the disc, it starts putting pressure on that outer skin, and that'll cause a bulge. But now this bulge is only going to cause pain if it pushes on the nerve root. So if it doesn't impinge on the nerve root, the patient might just feel like a dull muscle tightness, and that'll be about 5% of the pain felt by a nerve root compression. So it really depends where it is. Actually, I suppose while we're on it, an interesting fact is if we took 100 people, right, and give them an MRI scan, probably 80% of those people are going to have disc herniation because of all the things we do to our spine, the lifting and everything like that, but they won't be pressing on a nerve root, so we don't really know it's there. So like a bit of a luck of the draw. Most of the people we'll see will have it impinging on a nerve root, and so we need to sort of get that pressure off the nerve root.
Last time we spoke to you, Hamish, you were talking about using motor points and electroacupuncture, which seems to be a big trend now, electroacupuncture. Is that what you use for neck disc troubles as well? Look,
I use it for the neck. I mean, look, Ken, an actual disc won't have any motor points because there's no actual muscle there. But look, the best use of motor points in this instance, which again for your listeners, just is the very site at which the motor nerve signals the muscle. But the best use of motor points is to basically release those tight, dry, unlubricated neck muscles too that tend to be compensating and being really tight to protect the disc. So if we don't release those tight muscles, then they can't absorb as much blood flow, and the disc can't absorb blood flow. So yeah, that's a really important part of treatment in my view too.
Another condition, and we have a bit of time here, so we'll keep going.
Yeah.
The Western name is torticollis, or the more common name is wry neck, or what the patients will say is, I woke up this morning and my neck is locked in a position. And often for no apparent reason, they didn't do anything yesterday, lifting concrete bags or doing anything like that. And these patients, they tend to want to shy away from manual type therapies such as maybe manipulation or mobilisation, but out of fear that it's going to aggravate it more. But can you tell us a bit, like, what would cause this or why it's caused?
Yeah, look, I mean, like yourself, Heiko, I see a lot of wry neck conditions because it's just so common. It's probably one of the most common neck conditions, and you really don't have to do much to get it. So wry neck, it's simply, I mean, to me, it's like a descriptive term for like an acute, stiff, painful neck, and that can really be caused by anything, by being at the computer too long, or sleeping on a couch, or having an improper pillow maybe, or look, even on those hot nights, this is where you'll find too a lot of patients get into trouble because it's a really hot night, and what they do is sleep directly under a fan or an aircon vent or something like that, and then the cold air causes that acute muscle contraction and again interrupts that supply of blood, but then the muscles go into this tight compensation that causes that characteristic acute pain. But it's actually really in a really easy condition to treat, and normally one or two treatments, as you'd find too, Heiko, will set it straight.
Yeah, it does respond really well.
Yeah, well, as long as the patient doesn't keep doing the things which aggravate it, which that makes it difficult if they have a job or a hobby that tends to aggravate it. So, like I mentioned, stay there in IT or a receptionist looking at the computer all the time, or look, maybe even like a teenager who loves their PlayStation or Xbox and a few hours a day they're on that too.
I wonder, Hamish, you hear a lot of people wake up in the morning, they've got a stiff neck, they wake up, they've got a headache, they've got numbness in their arms and their hands, and it's coming from the neck. I mean, how do you treat that? Is it as simple as saying, get a new pillow?
Yeah, you know what, Ken, I'd fully put that down to an improper pillow because, I mean, and they'll come in and they'll say, after they might have a treatment and they might say, look, it felt okay that day, it felt really good, but then the next morning it was sore again. So, if they go to bed okay and then wake up in the morning with numbness or pain, the first thing I do is I'll get them to bring their current pillow into their next appointment, and then I'll do an actual postural assessment. And look, we tailor pillow fittings here at the clinic as well because I think that's just a really important part of dealing with the cause of neck pain. So I'll do a postural assessment and tailor fit them to a pillow that's going to support their neck and spine and try and eliminate the actual cause of their neck pain. But I'll tell you what, some of the pillows that I've seen and make you cringe. It's obvious at first glance that this is not the right pillow for them, and it is the main cause. So yeah, Ken, I'd definitely look at the pillow first.
Now, with one of the other very common problems I find with neck, which I see quite a bit of, is actually whiplash. And of course, I'm biased, being an acupuncturist, that it's the superior method of treatment. But Hamish, could you tell us, the listeners from the Western medical type of treatment approach, what they do, and then perhaps talk about the Chinese medicine approach, compare the two?
Yeah, sure. I mean, with the whiplash, I mean that's quite a traumatic injury. I mean, obviously, the most common way you might get at that is from a car accident, as your listeners would be well aware. But, I mean, obviously, we might see people, rugby players, footy players, sports players that get collided into from behind, and that puts their neck into that sudden flexion followed by sudden extension, and it places a lot of strain on those cervical vertebrae. But, yeah, look, in Western medicine, I suppose common medical treatment will generally involve the application of ice for the first few days, and then there's going to be some kind of anti-inflammatory medication that's prescribed, things like, I suppose, the common ones, ibuprofen or Advil or Voltaren. And look, in my view, I mean, as you know too, they'll take the edge off, but it doesn't really address the actual healing side of things. But, that's where we come in, of course. And as we mentioned before, the muscles are really inflamed and tight from the trauma. So they're going to need a good blood supply to lubricate and cool them and give them elasticity. And as you know, that's where acupuncture really shines. The suction cupping, I find, and you find too, another really excellent form of treatment to try and achieve that relaxation and the lubrication of muscles too. And obviously with the case of whiplash, we need to be on the lookout for those red flags as well. If a patient comes in and is getting extreme dizziness or blurred vision or difficulty speaking, that kind of thing, we really need to be on the alert for those things too.
I wonder, whiplash will be covered by ACC here in New Zealand, Hamish, and I guess it's pretty common, but are you guys finding that you're the first port of call for treatment for whiplash, or are you, hey, look, let's try acupuncture, God, we tried everything else?
Well, I don't know about you, Hamish, but for me, it's usually that, they've been through the Western medical model, they might have been given a neck brace and anti-inflams, mobilisation and, the collision drag, and then finally as a last resort, they're still getting headaches or something. So then they come to me or to come to the acupuncturist. But what's it like for you?
Yeah, look, it's similar. It's actually as well a bit of a mixture for me too, mate. I mean, look, if a patient has never seen me before, then normally if they get a whiplash injury, they're normally going to go to a doctor or a hospital to get checked, which is, absolutely fair enough. But, sometimes when you notice that we'll get regular clients that we're seeing for other things, and then we become their first port of call for them with any sort of health issue. So they'll be seeing us for something else, but then they'll go and get a whiplash injury and they'll present to us first. And having said that, there are a few patients who have come to me with whiplash, and again, talking about those red flags, I have sent straight to the hospital because they're displaying some of those things we talked about earlier. But, if they come to you first, then, again, we need to be on the lookout for those.
Just about running out of time, Hamish. What other sort of neck problems do people come to see you about? Yeah,
look, we see a fairly broad range. We've already mentioned disc herniation and whiplash and wry neck, but, other common ones, even like arthritis of the neck, that we also can call cervical spondylosis, where we get the actual wearing down of the disc, and that puts a lot of pressure on the nerve roots as well. We can get tension headaches, migraines, neurological issues like spinal stenosis and things like that. And look, just good old general muscle tightness, which again is a really easy thing to treat. So yeah, really the full range we see here.
Yeah, well, maybe another time I'd be interested to have a talk about in the future with the stenosis, because I have had a few patients with that over the years with results. So yeah, I'd be curious to talk with you about that at one stage. But we'd probably better finish off for now, Hamish. But thanks again for joining us, and we hopefully in sort of 2 or 3 weeks we'll be able to get you on again, and we can talk about another body segment, knowing how much you like to do that.
Absolutely, no worries at all. Cheers, guys. Thanks for the chat, and look forward to next time.
Take it easy, Hamish. Thanks for that.
And here we're going to finish off with the show with a song about the neck, and it's called "Wear My Ring Around Your Neck" by Elvis Presley. Does that get approval from you, Ken? Or?
Just approval from me, Heiko. But before we get to that song, just remind our listeners, if we want to come and see you for any acupuncture, not just for our neck, where do we find you?
206 Charles Street, Hastings. Go to my website, www.acu123.co.nz.
As always, our pleasure. Look after yourself. Talk to you same time, same place next week.
Good. Bye-bye.
This program was produced by and first broadcast on Radio Kidnappers, a volunteer-based community access station. For more information, go to www.radiokidnappers.org.nz. Thanks to New Zealand On Air for making this program available through funding the Access Internet Radio Project.